Imagine this. You're at home, perhaps watching TV, using your phone, or eating dinner. You don't feel sick. There's no pain, no discomfort. And then it hits you. You clutch your chest, fall to the floor, and gasp for breath. Have you seen this scene in a movie or on TV? Well, that dramatic image is how most people picture a heart attack, but it's not always the case. In fact, the signs can be subtle, silent, easy to ignore. And if you know them, you could save a life, maybe even your own. That's what we'll talk about today. 10 heart attack warning signs you may miss and why knowing them could save your life. First, what is a heart attack? A heart attack occurs when blood flow to the heart is blocked, usually by a ruptured plaque in a coronary artery. The heart muscle works 24/7, and if the blood supply stops, damage begins within minutes. The longer the blockage lasts, the more muscle dies. A heart attack is not the same as cardiac arrest. In cardiac arrest, the heart stops beating due to an electrical failure. In a heart attack, the heart is still pumping, but with difficulty. And sometimes, one can trigger the other. Here are the 10 warning signs you need to know. Number 1, chest pressure, tightness, or discomfort. This is the classic symptom, more common in men. Women can experience it too, but often along with other symptoms. It can feel like a weight on your chest, tightness, or fullness. Sometimes described as an elephant sitting on you. Number 2, shortness of breath. If you can't catch your breath, even at rest, this is a warning sign, especially for women, older women, or those with diabetes. No. 3, cold sweat. A sudden, cold, clammy sweat is your body's response to stress due to lack of oxygen and low blood pressure. It's worrisome if accompanied by nausea, dizziness, or pain. No. For pain in other areas. Heart attack pain isn't always in the chest. It can radiate to the left arm, neck, jaw, shoulders, or back, especially between the shoulder blades. Men usually feel it in the arm and shoulder, women more often in the jaw or back. No. 5, nausea, indigestion, or stomach discomfort. This is triggered by the vagus nerve, which connects the heart and digestive system. Women report this more often, and it's easy to confuse it with food poisoning or acid reflux. No. 6, dizziness or fainting. A sudden drop in blood flow to the brain can cause dizziness or a feeling of faintness. In a heart attack, this happens suddenly, not gradually, as with dehydration. No. 7, extreme fatigue. Not just a little tired, but it goes away with simple tasks like combing your hair or getting dressed. For some women, this is the only symptom. No. 8, anxiety or feeling down. A sudden surge of anxiety or an unexplained feeling that something is really wrong can happen before or during a heart attack. This doesn't just happen in your head. Your brain is reacting to the loss of oxygen. No. 9, heart palpitations or irregular heartbeat. Your heart may feel like it's pounding, skipping beats, or racing. Under extreme stress, the heart's electrical system can fail, sometimes leading to cardiac arrest. Number 10, an instinctive sense that something is wrong. Many survivors say they just didn't feel right. They couldn't explain it, but they knew. If your body tells you something is wrong, listen to it. Men vs. women, different warning patterns. Men are more likely to experience the classic chest pain. Women are more likely to experience more subtle symptoms. Fatigue, shortness of breath, back or jaw pain, nausea. What to do if you notice these signs? Let's call 911 immediately. Do not attempt to drive. Symptoms can worsen quickly. Remain as calm as possible and wait for help. Don't ignore it. If you're wrong, it's a relief. You're right, it could save your life. Most heart attacks can be prevented with healthy lifestyle choices, but when they happen, timing is everything. Know the signs, trust your instincts, and never hesitate to seek help. If you found this helpful, please share. You never know whose life you might save.